It is easiest to begin by reducing the important points down to their simplest elements. What you see here is a side view of the ribs if a person were facing right. It shows the ribs, the top of the hip bone, known as the iliac crest, and the pubic bone. The red dots represent the points on the bones that should match up in a straight line. The bottom of the ribs, the front of the iliac crest, known as the ASIS, or the anterior superior iliac spine, just to be fancy, and the center of the pubic bone, known as the pubic symphysis, should all be in a straight line perpendicular to the ground. Add the element of the psoas. The psoas are connected to the discs and vertebrae of the lumbar spine and extend forward over the pelvis, attaching to the inner aspect of the femur, the big bone at the top of your leg. They are responsible for lifting your leg and are triggered automatically by your autonomic nervous system. When adrenaline is released, your psoas contract for the fight or flight response. This contraction brings your upper and lower body closer together. We have learned to inhibit this response because it doesn't look cool to startle easily. As we exert this control over that response, our psoas become short and tight. Over time, this shifts the ribs forward, pulling the upper body out of alignment. A line drawn from the ribs to the ASIS to the pubic symphysis is not straight and perpendicular to the ground but slanted inward. This pattern of rib thrust isn't solved simply by bringing the ribs down. Often a holding pattern in the neck corresponds to a rib thrust pattern. Bringing the ribs down can cause your head to come forward out of alignment. So rather than lift your head and compress the vertebrae in your neck, known as the cervical vertebrae, ramp your chin straight back and lengthen the back of your neck. Rib thrust also creates a compression in the low back. As you bring your ribs down, it can trigger an unconscious pattern of tucking your tailbone. This flattens out the S-curve in your low back. The S-curve is necessary for optimal alignment because the spine is able to absorb the shock of every step you take. It acts like a slinky, distributing the force evenly and vibrating the whole skeleton as it responds to this loading with increased bone density. When the low back flattens out, the shock isn't evenly distributed, and the vertebrae are asked to bear more than their fair share of the load, causing degeneration. A tight psoas can further exacerbate the problem by pulling the vertebrae closer together. Rib thrusting and lower back compression also transfers pressure forward, increasing abdominal pressure. This, combined with a tucked tailbone, contributes to pelvic floor disorder. Allow your tailbone to remain untucked as you bring your ribs down. A correction for rib thrusting habit can be to lie on the floor and put your attention on sinking your chin toward your chest, sinking your lowest ribs down, and sinking your tailbone down to the floor. You will notice a tunnel between your low back and the floor. I call this a mouse tunnel. There should be enough room for a mouse to crawl under. Some fitness instructors will tell you to make that space disappear. With an alignment perspective, I have explained why this is not good for your health. You can also make this correction by backing up against a wall and noticing those same points. This will contribute tremendously toward alleviating neck pain, back pain, breathing problems, anxiety, problems of indigestion and elimination, prostate disease, uterine prolapse, and other pelvic floor disorders. This is a big deal.